What if your next dental exam wasn't done by your dentist, but by an AI? AI is already doing a whole lot, even in dentistry. It's already detecting cavities, helping detect gum disease, and it's even helping with insurance. And that's literally just the beginning. But could AI actually be doing the actual drilling and filling and doing the day-to-day dentistry? Well, let's talk about how this technology can completely change dentistry forever. So right now, AI is literally being used in dentistry. It's being used everywhere. So now more and more dental offices are getting these dental softwares that actually have AI incorporated into it. What do these AIs look like? So for example, if you take an x-ray, typically the dentist will show the patient like, hey, there's a cavity starting here, you can actually see it on the x-ray. But these AIs will actually automatically detect those cavities for you. So now instead of the dentist showing the patient, it's the actual AI showing the patient that, hey, here's the cavity, it's highlighted on the x-ray. And it can even do more. It can spot bone loss, gum disease, infections. And again, it'll highlight all of this in like different colors and like label it and actually show the patient really well, probably better than a dentist could. I mean, the dentist will be able to show everything, but the actual highlighting and how it actually visually looks from the AI, it'll actually be a lot easier for patients to understand this. Now, AI also helps with treatment planning. So some dentists will use a scanner where they literally take like these 3D images, not like a 3D x-ray, but like literally just pictures of your teeth, and it just kind of shows up on this screen, and it shows like how your bite is, what your teeth visually look like. And you can use this scan to do all sorts of things. So like instead of taking a physical impression, now you have your scan digitally saved on the cloud, so you don't have to do all that gooey stuff. But within that scanner, there's already AI that's incorporated. And this can help with things like day-to-day stuff, like your crowns, or your implants, or even like your aligners, like your Invisalign even uses some AI. And one of the other biggest uses is with insurance. So right now, you've probably heard that insurance companies are denying a lot of claims. And this is nothing new. It's so hard to get something approved by insurance. And it's only getting harder because now insurance companies are using AI to help deny claims. I've talked to multiple people who work for insurance companies, and they are told that they have to deny a certain amount of claims. Whether or not it is justifiable or this claim is actually like what the patient needs and the doctor has to do this procedure, they have to deny a certain amount of claims. And I've seen this firsthand in my office. Every single week, it's the same battle with insurance. We'll send x-rays, we'll send images, we'll send a note, all this stuff basically showing why this patient needs this procedure, only for the insurance company to deny it for one reason or another. I've even had some insurance companies saying, you didn't send any x-rays, even though we literally did send x-rays. And we point that out, and the insurance company still denies it. And this can go back and forth and take a long time for that to actually get approved. Meanwhile, the patient is waiting, they are in pain, and they just want to get their procedure approved because their insurance says they will cover it if they approve it, and they don't want to pay out of pocket for it. But now these AIs are being used in dental softwares to help fight these claims. So now if an insurance company denies a claim using their AI, we have our own AI that's saying why it should be approved, and the AIs are just going to keep fighting each other. So it's kind of like an AI battle. I don't know if this is necessarily good or not. It's like saying like, hey, that country has some nukes, so we need our own nukes too. But either way, it can save a lot of time and money on our part, because instead of wasting our time going back and forth with the insurance companies, we have an AI that's doing it for us. Now, this is where the AI is currently, but we know it's going to keep improving. Every single day we hear about how AI keeps getting better and better. So what are some of the near future uses of this AI? Well, some of this is already being done. So something like a chatbot with the patient. So right now, typically patients will call the dentist if they want to make an appointment, for example. Or if a patient chips a tooth, or if a patient randomly has some gum pain or something like that, and they want to get seen, or they don't even know if they want to get seen, they just want to kind of talk to someone. Now you can talk to an AI instead. And this is useful just because sometimes dental offices are closed on weekends, and usually dental problems happen on a weekend or a holiday. And this can be really hard because there's not many people to talk to. But now you can talk to like an AI answering machine or even message an AI, and it can tell you if you should actually be seen, or if this is actually an emergency, or if this is just something that is normal, and maybe some certain steps you can do to help mitigate the pain. The other intriguing part about this is AI can detect almost any language. So, for example, if you speak Spanish and you don't really speak good English, but you go to your regular dental office and they have a hard time understanding you, now if you speak to this AI in Spanish, it can respond to you fluently, so you can even understand the treatment plan even better. Now, what are some things that are going to happen pretty soon with AI? Well, I think AI is going to be really good at like a personalized prevention. So instead of a one-size-fits-all solution, dentistry is actually kind of complex, and every patient is slightly different. Every patient has a different microbiome, every patient has different problems, they have different diets. gets. So now if you input all of this into an AI, it can come up with a more personalized prevention plan for you. And it can even detect, like, based on your characteristics, who's most at risk for gum disease, who's most at risk for cavities, who's most at risk for both. And based on that and your medical history, all that stuff, it'll come up with the actual prevention plan for that specific person. Some other uses that are already being started, but I think are gonna keep getting a lot better, are uses in like 3D printing. So right now, some dentists are able to 3D print like a crown or a veneer in their office. So if you go in for a procedure, typically if you need, like, for example, a crown on your tooth, you need to get it sent out to a lab, and then they need to design it and then send it back to you, and then you bring the patient back in to deliver the crown. But now more and more people are using these 3D printers where they can use tools like a software, and more AI is probably gonna get incorporated into this to actually design that crown in the office and then give it to the patient the same day, so you don't have to come back. Now right now, I think the materials for these 3D printers have to improve a little bit for it to be used in every single case. I still think there's plenty of cases where you cannot do it all in the office, and that's just because the materials that these 3D printers use in dentistry are still really limited. So certain cases you still cannot use that in office, and you'll have to come back. Something else I think is going to be incorporated with AI is something like a digital twin. So a lot of times patients are presented with these big treatment plans, and they're wondering like what their mouth is going to look like. Now a digital twin would be like a virtual simulation of your mouth, only a duplicate of it. So all that treatment will be simulated on that, so you can see what it would actually look like before you get anything done. Now that's all cool, and I think that's all totally realistic, and I think that's something that's going to happen in the near future. But what about even more than that? I'm talking about like the big leap, like robots doing our surgeries, doing our dentistry for us, and the dentist is just chilling in the back playing video games. Or the dentist is out of a job, and that would suck. Well, right now there are actual robotic systems that help doctors do surgeries. This is used more in like delicate procedures, so like neurosurgery, heart surgery, prostate surgery. But if it's already being used in these other surgeries, there's no reason to think that it can't be used in dentistry. Like, there's no reason to think that an AI or a robot will not eventually be able to place an implant or do a filling or do a crown. And if you don't believe me, there's already an FDA-approved robotic system that can assist with dental implants. It's called Yomi, made by a company called Neosis. So yeah, it's definitely possible that like 20, 30 years from now, instead of a dentist doing that procedure, it's a robot. And the robot will probably be doing it better. Now, I think what'll happen first is the dentist and the robot will be working together, and then the robot will be strictly for just helping the dentist and kind of guiding the dentist. Now, let's just pause and look at the bigger picture for a second. First of all, are we going to trust a robot over a human dentist? It's funny because I've actually talked to a lot of people, like a lot of friends and patients about this, and most of them, at least the ones that I have talked to, said they would not trust a robot doing dentistry on them. But that's obviously right now, because right now, I wouldn't trust a robot doing dentistry on me because we just don't have the technology yet. But 30 years from now, or even sooner than that, we might have that technology. But also, a lot of patients appreciate the human side of going to the dentist too, because most patients are anxious, they're scared, they're in pain, so they also need some empathy, and they need proper communication before they can trust something. Will AI be able to incorporate that human element too and actually have some empathy with these patients? I don't know. And obviously this is all just hypothetical stuff. And if robots are being used in dentistry, that probably would mean it would be used in other aspects of medicine too. But I don't know if that would completely get rid of the medical and dental profession. But I do know that either way, it will enhance dentistry, it will make it faster, it'll make it smarter, and it can help make it more personalized. And if it does turn out that a robot takes my job, well, hopefully I can find something else that I'm good at. Anyway, thank you guys for watching. I hope you liked that video. If you haven't already, hit that thumbs up button and subscribe to my channel below. And I will see you guys in the next video. Do you brush and floss every day but still get cavities? You're not alone, and I'm gonna explain why this happens. It turns out that cavities are a little bit more complex. It's not just about how often you floss or how often you eat sugar. Your genetics, your saliva, the bacteria in your mouth, all of these things play a major role. But the good news is once you understand